I think for Australia that is not the case. But I think what government trying to do is making sure that there is a linkage between each of the sectors.
Mhm. And as you talked about the Care and Support Economy Task Force, there was a draft paper on the strategy on care and support economy, and there's a final paper on the final strategy on care and support economy. Can you just give a timeline on how and what were the trigger points to start that piece of work, and then where it has culminated?
I think a few years ago, Jim Chalmers obviously, see this care economy as an opportunity. So, he did set up task force, sitting under his department. But I also know that, the Productivity Commission obviously, has done a lot of work, more recently in terms of not only highlighting the opportunities, but also in terms of, I guess, like how, I guess, we, in terms of, not only the community, but also the industries, can actually invest on the care. I haven't seen any other work, I guess, since then. So it's more about, I guess, policy implementation at this stage. In contrast, though, if you compare that with other countries, because I do a lot of work, for example, in the Southeast Asian countries, in the ASEAN, they actually not only invested a lot in the care economy, the government actually embraced that, in a much more significant way. If you like, compared to the Australian government. So they put in more, I guess, policy and resources to make sure that there is a strong public-private partnerships around the care economy.
So the opportunities are, so when they use the term care and support economy, the draft paper talked about the definition of that is limited to aged care, disability, early childhood and veterans care. And when you use the word integration, the idea is to bring them together and merge them into one sector. Is that where we're going for the care economy work?
So I think for Australia that is not the case. But I think what government trying to do is making sure that there is a linkage between each of the sectors. So for example, that we do know, for example, like older people may also need to access mental health. Same with the veterans might need to also access mental health or even aged care. So this is where I guess the problems here in Australia is that duplication. So the integration, in this case really is trying to avoid duplication and trying to make sure that people actually receive much more continuous care along the life course.
There is no body which overlooks across. So do you think getting the departments working together, is that and how do you bring them all together? As in, what's your understanding? Is there a piece of work being published that how will it operate, or is it just identifying, okay, there are parallels between, for example, workforce regulation, let's bring them parallel, so we have done that, or quality and safeguards are very similar between age and disability, let's do that?
I think the good thing about Australia is that everything actually sits with the Ministry of Health. So it's now is health, disability, and aging. So those three at least sitting under one ministerial portfolio. So that is a way, I guess, that an integration can be achieved. But obviously the funding mechanism itself will be very complex to navigate. And this is not only in terms of the policy of the funding, but also in terms of how people can actually access the funding.
I think